Okay, we're recording now. There's a lot of bleeding between the first and second premolars on the left upper. And there's a lot of bleeding between the first and second premolars. You've got that down. Okay. There's a small amount of bleeding between the upper left premolar and first molar. There's a moderate amount of bleeding between the upper left first molar and second molar. Second molar and third molar. Let me just correct that. Okay. So now count up the number of missing teeth and divide by 32.
Roughly bleeding index would be 25%.
Okay.
25%.
The total bleeding score is what?
27.
The total.
Sorry, total bleeding score is 24.
34. Okay. So it's about 28%.
About 28. Yeah, something between. I said 25.
Well, no, 25 would be 30%.
Just a minute. How did you calculate it? I mean, 27 was number of teeth, 27, and
24 was the bleeding.
24 was the bleeding, yeah.
Okay, so it's not 25, which would be 30%. So it's a little bit less. So let's say 28%.
Yeah. Okay.
So write this in red.
Yeah.
As big as that. Okay.
Yeah.
And you now I need to change this because I wouldn't show this to the patient at this stage. I'd be saying, while I'm doing the bleeding index, I'll show you how you can stop this from happening when we finish. Okay. You're looking doubtful.
Yeah, but would you wouldn't show the numbers?
Not at this stage.
Okay.
I'd immediately show them how to toothpick.
Why not show the numbers now?
I just preferred to do it this way. And then I showed them the numbers
Okay.
when we finish
Okay.
the toothpicking. Now tick gum check in your, do you still have your original sheet?
Yes. Which sheet, sir? Which sheet? General chart? Medical history.
Your examination chart.
Yeah. Yes. I don't like saying yeah, but still I just keep saying it.
Let me just correct this for a minute. Do you show the patients a video at all?
90%.
90%. Very good.
I always wanted to ask you, how come you didn't show the occlusal brushing in that video?
I don't believe that brushing the occlusal surfaces has any effect on dental health.
What about all the food debris that's lying on the occlusal surface?
Do you have much food debris on your occlusal surface? I don't believe it occurs.
Some people do have.
I just don't think it's important.
Okay.
It's the plaque at the gum line that makes the difference.
Yeah.
That's why the oh shit. Shouldn't have said that. I'll show you something here. Did you notice that, Ashwin? Just let me show you this a minute. Do you notice those extra words there? You see to the patient.
Mm-hmm.
Shouldn't be there at the moment. Right? It should come up later on, okay? Now, the reason for this is that if just move this down, that's curious. I have to sort that out later.
Why is that?
So then you give the patient 2 packets of toothpicks.
Mm-hmm.
Do you remember why you do that?
One for the person who asked him.
Yes. Yeah. Okay. Now write up on the medical 4 sheet, the medical and dental history on it. Do you still have that?
Yes. Just 1 second. Just come.
Yep.
1 second. Yes. Yeah.
Okay. So you've written this, you put NPXM taut TP on the nose, right? You don't have to write toothpicking. Okay. Now put the date in today.
What date?
What date is it?
Yeah.
10:05. 10:05:21.
Yes.
And then put in your charge.
Yeah.
This appointment would take about 40 minutes. That's including the proper examination, the full exam.
Okay.
Maybe a bit longer.
Mm-hmm.
And then, do you remember when we did the examination on this patient and looked at the x-rays, there was some tooth decay. What would you plan to do the next visit?
Check sugar. And maybe fill the tooth.
Maybe
No, fill that particular tooth.
fill a tooth.
Yeah.
Okay. How about doing the filling on the on the upper right second molar?
Upper right second molar. Yeah, that's fine.
So what would you write down for the next appointment?
CK sugar.
Yep.
And fill 17.
Yep.
What else?
Well, what did you do on the first visit?
What did I do on the first visit?
What have you just written?
Sorry. Check CK sugar, CK TP.
Yep.
And and fill 17.
So teach TB.
Teach TB, yeah. Okay.
Teach toothbrushing. Okay.
Yeah.
And then fill 17.
Yeah.
Okay.
Teach TB, grade 17.
And how long is that all going to take?
1 hour 10 minutes.
Right. How many units?
8 units.
What?
I mean, or 7 units. 7 units. Wait. What happened?
Because you're an Indian.
Right?
You're mathematicians. 1 hour, 10 minutes is 8 units. No.
7
Okay.
units. Okay, sometimes we make mistakes. Sometimes. It's part of being human. It's not being Indian.
Now, when would you want to see the patient again?
I would want to see the patient again 2 weeks' time.
I would suggest 1 week. Oh.
Sorry? Can't hear you.
I would put 1W, 1 week.
1 week.
Then
Voice is breaking.
okay. bear in mind that if you start cleaning your teeth, between your teeth, the bleeding will reduce within about a week to 10 days. Okay? So I want them to come back and say to me, when I say, how's the bleeding? I want them to be able to say, oh, it's much better. Isn't that great?
Yes.
Okay. So you wouldn't want to leave it 3 or 4 weeks because you need to help them improve their toothpicking. So put in 10D there. Now the patient goes to the reception desk and the receptionist takes the payment and enters this on the accounting section of the accounting and appointment sheet, planning sheet.
Yes.
So put in the payment now. And the balance.
Okay.
And then she'd make another appointment and enter the information on the appointment planning sheet. Put it in the appointment book.
Yeah, done.
Is your appointment book looking like this?
No. We don't usually, I mean, I haven't started actually blocking out those chines.
Make a note to download.
Download. I mean, it's looking like this only. I'm saying that those lines I haven't striked out.
Oh, you have printed the sheets.
Oh, I have done that, yeah.
You printed the sheets, and have they circled
Yeah,
Friday?
that's all done. That's all done, except for these crossing outs.
So how do they know when not to book patients?
Yeah, I mean, they just know it.
It has to be in pencil. Okay. And she enters the date on the accounting and appointment planning sheet just here in pencil.
Yeah.
Okay. So that's the end of that patient. Okay.
Mm-hmm.
We now have a 70-year-old man who has a plastic denture, which he doesn't like. Have you remember this patient? Okay. So he came.
We stuck the wires.
Yep.
Yeah. Okay.
Okay. Oh, yeah. I just need to make a note. I would glue that tooth in and take an impression and have the technician make 2 or 3 wires, twist flex orthodontic wires Have you ever, you do that, do you, with your orthodontic patients?
Oh yeah, I mean, we don't use the, you mean to prevent space opening, right? For that, right?
Yes, yes.
Yeah, so we don't, we have another wire called, not the twisted one. It's, I'll show you the picture, sir. It's a more refined one. It's a very thin wire, but the cross section is a little bit different. It's a U-shaped cross section, and it's pretty expensive. I'll show you the picture so you get the idea. But it's not a twisted one.
Okay,
It's
send
a
it to
single
me.
this thing. Yeah, yeah.
Send it to me. So I take an impression that goes off to the laboratory. They they bend up those wires for me. And the wires are attached to an acrylic piece that fits over the incisal surface.
Wires fit onto the acrylic surface. I didn't get you. Should be that?
On the model.
Once it's breaking in between, sir.
Okay. The wires are on the model.
Yeah.
And where you see the ends, wires, they come up and over the inside surface.
Okay.
And some acrylic is put on the incisal surface to incorporate those wires.
Why do you want to extend it to the incisal surface?
Then you pick up the acrylic that's on the occlusal surface that the wires are attached to.
Okay.
You put the acrylic onto the patient's occlusal incisal surface,
Okay.
and the wires go in place on the palatal side.
Okay.
You then having etched the surfaces, you then with flowable composite glue the wires to the teeth.
Okay, got it.
Okay? Mm-hmm. You then cut off the wires to the length they are.
Yeah.
And you
Sorry? Why is it breaking? Yeah.
You throw away the stent.
Okay, I understood. Yeah.
That held the wire in place. I need to send the pictures of this. Okay.
Okay, I got it. Yeah.
Got it. So this patient wants an implant, but during the time that we're going to prepare the patient for the implant and the time that the implant's put in and restored, they're going to have a fixed tooth there, not a little denture. Okay.
Thanks.
So now for this patient, what sort of history would you?
Can we just go back to the first slide, the 70-year-old? What else is there? No, that's it. Okay. 70-year-old person, what history I would take? Check for any medical conditions that he's having. Is he a diabetic? Is he under any medicines? Is he under...
You'd basically take this history.
Yes.
You need all this.
Yeah.
Okay.
Yeah. Yeah.
And because you've got this in the patient's notes, you don't miss anything. As opposed to just using your memory.
Yeah.
Okay. What x-rays would you take for this patient?
What x-rays would I take? Take bite wings, PA view of that particular region, and 4 bite wings, PA view of that particular region.
So you take 4 bite wings and 1 periapical.
One, two, three, four. 8 bite wings, vertical. Nice situation.
8 bite wings.
No, sorry. 1, 2, 3, 4. Yeah, 8 bite wings. Yeah.
Well, in your
Sorry. Absolutely sorry. 4 bite wings and 1 periapical.
Yeah, and with your X-ray sensor, you'd be taking 6 bite wings.
6.
You take 6 vertical bite wings.
Yeah, 6 bite wings.
3 each side.
Yeah, true. Sorry. 6 bite wings, 1 periapical.
Right. Okay. So these are the X-rays that I took.
Okay. It's bone level.
Yeah.
Is that root caries?
No. Where is that?
Previous. Yeah, that one. The premolar. Nasal aspect, first premolar.
I don't know. I don't know. I don't recall results in X-rays. Do you know what I mean?
No, just repeat that, sir. You broke in between. What is that?
Now, if you look at that first mesial, okay, and then you look at it there.
Oh.
We're looking at the, I think it's called the canine fossa. There is a groove. There's a groove in the roots.
Groove in the roots.
Do you see my 2 fingers here?
Yeah.
There is a space just here.
Okay,
just here.
Uh-huh.
So if you look at that mesial of the premolar, and then you look again, it's a radiographic artifact. Okay.
Is he diabetic?
No.
So much of bone loss.
So this patient needs complete mouth x-rays.
Is this the same patient that we're talking about now?
Yes.
Okay. Yeah.
So if you'd only taken 2 bite wings, 4 bite wings, 6 bite wings and a periapical, you might have missed quite a lot of that.
So, so what would be the triggering factor for us to take the complete mouth x-rays?
You'd notice that the patient had a little bone loss.
Yeah, that's the point that we should.
Yeah. And you don't just take the areas where there's bone loss. What do you think that is?
No, we would like to get the bigger picture. I would probably send him for an OPG.
Don't need one. Don't need one. Having said that, I took an OPG, but I think the complete mouth x-rays show up better than an OPG. But an OPG gives you a nice overall look.
Yeah.
Look again at that premolar. The upper right first premolar. Do you see how we know there's no tooth decay there because we can see there's no tooth decay on that bite wing x-ray. Okay.
Yeah. Yeah.
So you have to be careful about that. Now the reason why you'll see now why you take complete mouth x-rays. I mean, the other question is why not? You know, if you're doing a thorough evaluation of the patient and they're going to spend a reasonable amount of money on the implant, I'll show you the reason. Now, we're going through the x-rays with the patient and we're showing them the fillings.
Yeah.
We're showing them the bone loss here, okay? And we're showing them the bone loss here. So here they can see the bone loss, but this is a bit better here. Do you see how you can show them that this tooth is in a better situation? And I would take a pen and I'd say, do you see that premolar tooth there is like this? Okay. It's being held in bone like this. Whereas this one is being held bone like this. This is better.
Yeah.
Okay. Now, on your chart, in a red pen, draw in the bone level from the Actually, we'll, yeah, drawing the bone levels here, okay, with your red pen.
Yeah.
Okay. Now continue drawing on here. And draw the bone levels here. Okay. And then here, drawing a red line going all the way along where the bone levels are.
Yeah. Yeah.
Now draw a red line down with an arrow indicating that there's a buried tooth there.
How do I draw that?
Just an arrow going down the tooth. You can even write buried next to it.
Okay.
Then if you go down here, just drawing the bone level here. And here. Bit difficult to see there, but I think the bone level is quite good there. Then drawing the bone level here. And put a blue line down this tooth, the third molar, because it's missing.
Yeah.
You see, if you do this sort of charting, when the patient's gone, you can then sort of work out a treatment plan because you've got all the information there.
Yeah.
Okay. Also, needs a red line down that buried root there, buried tooth.
Yeah.
So you then take those x-rays, you see the patient again, and you look through the x-rays with the patient like we just looked. And then you do the charting using this sheet here with the patient. And then you do a bleeding index, show the patient the toothpicking video, and then teach them toothpicking. So this was his original bleeding index. He'd already been taught by somebody else a little bit about dental health.
Mm-hmm.
So here he is toothpicking away. I then saw him about a week to 2 weeks later, checked his toothpicking, showed him the toothbrushing video, and taught him toothbrushing. Best technique of toothbrushing, scrubbing up and down as you've learnt, 45 degrees, scrubbing in and out on the front teeth 10 times. And then about 1 to 2 months later, I did a gum check, toothpicking check, toothbrushing check. He got down to 18%. Bear in mind, he's got pockets, okay? So he's not likely to get it down completely without some intervention. I then showed him the interdental brushing video, and then showed him the green interdental brushes. He then came back and I checked the toothpicking, toothbrushing, and the interdental brushing. And then I showed him the mauve and the gray. I did not.
Do you bend the green brushes as the patient goes posteriorly?
No. No. They need to. They may get bent,
Mm-hmm.
but very rarely I'll do that.
Okay.
If you bend them, they break more quickly, I would think.
Okay.
I only showed him the green one to get him used to using the brushes.
Okay.
When he came back the next visit, I showed him the green and the gray because he only had to do those in certain places.
Mm-hmm.
Okay. Then I reevaluated him, and he hasn't really changed his bleeding very much at the moment.
Mm-hmm.
I made a note on his bleeding index sheet where he's using the different brushes. Okay, so that would remind me where to check. Okay.
Mm-hmm.
I then talked
You did
to
the
about
third bleeding index very soon.
Sorry.
You had taken the third bleeding index quite soon.
The second bleeding index I did a month later.
No, not this one, the previous one that you showed.
No, the first bleeding index was on the 26th of January.
No, you had shown me some other slide just now.
No, these were the ones.
Okay. Okay. Mm-hmm.
I should do these.
No, you had shown another one. So you showed me something on the 9th. Are you sure? There's no other chart nearby?
No.
Okay.
These are the ones I showed you before. It's the same patient.
Okay.
Okay. So I then talked to him about doing a scale and curettage. And at the same time as I did the scale and curettage, I took out the lower left molar. I've talked to you about the fact that the results of scale and curettage, gingivectomy, and flap operations are the same.
Yeah.
Yeah. Okay. And when you do this very thoroughly, how are you getting on with the scalers?
Yeah, good, sir. I'm using it.
Good. Do you sharpen them?
Not yet.
Have you got a sharpen?
I have a file, not this one. No, I don't have a sharpener.
Does the file sharpen scalers?
No.
Okay. Write a post-it to order a sharpening stone.
Okay.
You've seen the video, have you, on sharpening?
Yes, it's been a while, but I can't. I've seen it.
Okay. Review this when you get your sharpening stone.
Okay.
Okay. So then I curette with the 1718S.
Mm-hmm.
I then use an excavator to curette.
Okay. Why do you need an excavator?
Sorry?
Why do you need an excavator?
Because you find that you find more bits of granulation tissue. Okay. It probably gets into different places.
Okay.
And then ultrasonic scale, and then root plane. Yeah. Yeah, I'll be out in one. I'll be out in it.
All right, no problem. No rush, he's not here.
He's not here. Have a seat.
No.
I'm just zooming. Have a seat.
I will, thank you. Zoom on.
So, Ashwin, I then explain to the patient they may not be able to clean too well. Okay.
Yeah.
For 1 to 2 weeks. I then see them again. Introduce a wider interdental brushes because the spaces are bigger.
Yeah.
Okay. I then reevaluate a month later and check the scale and curettage, do a gum check, and then see them a month later, do another scale and curettage, and then see them 2 weeks later, month later. So this whole process may take a year. Now he's down at 3%.
Yeah, this was the slide I was talking about. You had taken a bleeding index, the previous slide. This one.
Yeah.
The same month you took another bleeding index.
That doesn't sound as if it's the same patient, does it?
Not sure.
I think it is. I don't know. Then I placed an implant.
Okay.
Do you notice how I'm always checking each time they come in virtually how they're cleaning?
Yeah.
Okay. Now he's down to 0.
Fantastic.
Now, this tooth, you could either just take the back root off and root canal treat it,